Hello everyone. Welcome back to our channel. Today, we will discuss with you one of the most sought after issues among adult male, hair loss. In this video, we will try to identify the symptoms, causes, treatment, or even regrow your losing hair with different ways. So sit back and relax and enjoy this video. Alopecia, or hair loss, can be temporary or permanent and can affect only your scalp or the entirety of your body. It could be brought on by hereditary factors, hormonal changes, illnesses, or a natural aspect of aging. Even though anybody can lose hair on their head, males are more likely to do so. Baldness often refers to a significant loss of scalp hair. The most frequent cause of baldness is hereditary hair loss as people age. Some people would rather let their hair loss progress naturally without treatment or camouflage. Others may disguise it with hats, scarves, cosmetics, or hairstyles. Others decide to use one of the treatments on offer to stop additional hair loss or encourage growth. Now, let's talk about its symptoms. Depending on what is causing it, there are many distinct ways that hair loss can manifest. It might affect only your scalp or the entire body, and it can start off suddenly or gradually. Hair loss symptoms and signs might include 1. Top of head thinning gradually. As people get older, they are more likely to have this sort of hair loss. At the hairline on the forehead, hair frequently starts to recede in men. Typically, women's hair parts are wider than men's. A receding hairline is a hair loss trend that elderly women are experiencing more frequently. Frontal fibrosing alopecia. 2. Patchy or circular bald patches. On the scalp, beard, or brows, some persons have bald patches that are round or spotty. Before the hair falls out, your skin may feel unpleasant or itching. 3. Hair loss that occurs suddenly. Hair may become loose as a result of a physical or mental trauma. When brushing, washing, or even with a little pulling, you could lose a few handfuls of hair. Although transient, this form of hair loss typically results in general hair thinning. 4. Hair loss across the body. Hair loss can occur all over your body as a result of several diseases and medical procedures, such as chemotherapy for cancer. Usually, the hair grows back. 5. Scaling patches that extend across the scalp. This is a ringworm symptom. Broken hair, redness, swelling, and occasionally leaking may also be present. Let us dig into the causes of hair loss. 1. Family history, heredity. The inherited disorder that develops with aging is the most typical cause of hair loss. Androgenic alopecia, male pattern baldness, and female pattern baldness are the names for this disorder. It often happens gradually and in regular patterns, with men experiencing a receding hairline and bald patches and women experiencing thinning hair at the top of the head. 2. Hormonal changes and medical conditions. Permanent or temporary hair loss can result from a number of circumstances, including hormonal changes brought on by pregnancy, childbirth, menopause, and thyroid issues. Alopecia areata, an immune system-related ailment that results in patchy hair loss, scalp infections like ringworm, and the hair pulling disorder trichotillomania are examples of medical disorders. 3. Medications and supplements. Some medications, including those for cancer, arthritis, depression, heart issues, gout, and high blood pressure, can cause hair loss as a side effect. 4. Radiation therapy to the head. The hair may not grow back the same as it was before. 5. A very stressful event. Many people notice general hair thinning many months following a traumatic event, whether it be physical or mental. Temporary hair loss results from this kind. 6. Hairstyles and treatments. Excessive styling and tight pulling hairstyles like pigtails and cornrows can result in traction alopecia, a form of hair loss. Permanent hair dye and hot oil treatments can both make hair brittle and fall out. Scarring might cause hair loss to become permanent. Prevention. Genetics is mostly to blame for baldness, male pattern baldness and female pattern baldness. It is impossible to stop this kind of hair loss. You might preventable kinds of hair loss by following these recommendations. 1. Handle your hair with care. When brushing and combing your hair, use a detangler and try not to pull on it, especially if it's damp. A wide-toothed comb might aid in preventing hair loss. Do not subject your hair to severe treatments like hot rollers, curling irons, hot oil treatments, or permanents. Reduce the strain on your hair caused by braids, rubber bands, and barrettes. 2. Consult your doctor if you are using any drugs or supplements that might be causing hair loss. 3. Avoid exposing your hair to UV rays from the sun and other sources. 4. Give up smoking. According to certain research, smoking and male pattern baldness are related. 5. Ask your doctor about a cooling hat if you are receiving chemotherapy. Using this cap during chemotherapy will lessen your chance of hair loss. Tips to regrow hair naturally. There is good news ahead if you are one of the hundreds of millions of individuals who experience hair loss on a global scale. Let's first think about a few things before moving on to the wonderful news. There are some decent items that truly work on the market today, despite the fact that there are many gimmicks and charlatans attempting to sell their wares to the unwary. Consider doing a few natural methods to regrow your hair before making a hasty purchase of a product. The unfortunate news is that many hair regrowth solutions do not work and will never work, as we have said. Let's now look at the positive news on how to swiftly and successfully regenerate hair. Although fast is a relative term, it is possible to regenerate hair in a respectable amount of time. We are discussing a particular cause of hair loss, which is a vitamin deficit. Many people are constrained by their everyday diets and fast food mentalities. The likelihood is that persons who are in this situation are not getting enough vitamin A, vitamin B, vitamin E, or folic acid. Each of these vitamins is essential for keeping healthy hair. One of the most crucial nutrients for maintaining healthy hair is vitamin A. This can be one of the fastest ways to restore hair if you often lack vitamin A. One of the main reasons why people lose their hair in the first place is because vitamin A is believed to moisturize the scalp. Biotin, an essential vitamin B component, is what causes this sebum release. Folic acid and vitamin E are crucial nutrients for maintaining healthy hair. Medication. Treatment for the underlying condition that is causing your hair loss will be required. Your doctor could suggest stopping taking a certain medicine for a few months if it's the reason you're losing hair. Treatment options exist for pattern, hereditary, baldness. The most typical choices are 1. Minoxidil, Rogaine. Minoxidil is available over the counter, non-prescription, in liquid, foam, and shampoo forms. Apply the cream to the scalp skin once daily for ladies and twice daily for males for the best results. Many individuals choose foam that is applied to damp hair. Many people use products containing minoxidil to either regenerate hair, decrease the pace of hair loss, or do both. To stop additional hair loss and to begin hair regeneration, therapy must last at least 6 months. To determine if the therapy is effective for you, it can take a few more months. To maintain the advantages of the medication, you must use it continuously even if it is helping. An irritated scalp and unwelcome hair growth on the nearby skin of the hands and face are potential adverse effects. 2. Finasteride, Propecia. For guys, this medication is prescribed. It is a daily medication that you take. The hair loss of many men using finasteride slows down, and some even report fresh hair growth. Before you can determine if it's working for you, it can take a few months. To preserve any advantages, you must continue taking it. For males over 60, finasteride might not operate as effectively. Reduced libido drive and sexual function, as well as an increased risk of prostate cancer, are rare adverse effects of finasteride. Women who are or might become pregnant should refrain from handling broken or crushed medications. 3. Other medications. Spironolactone, Carospir, Aldactone, and oral dutasteride are further oral treatment alternatives. Avodart. Hair transplant surgery. Only the top of the head is impacted by the most prevalent kind of permanent hair loss. Making the most of your remaining hair is possible through hair transplant or restoration surgery. A dermatologist or cosmetic surgeon performs a hair transplant operation by removing hair from a hair-bearing area of the head and transplanting it to a bald place. One-to-many hairs can be found in each hair patch. Occasionally, a wider section of skin is removed, including many hair clusters. Although you won't need to stay in the hospital for this surgery, it is uncomfortable, so you'll be given sedatives to help with the pain. Bleeding, bruising, edema, and infection are all potential dangers. For the desired result, you could require more than one procedure. Despite surgery, hereditary hair loss will ultimately worsen. Lifestyle and home remedies. To find a hair care technique that helps you feel better about the way you look, you might want to experiment with several ones. Use volumizing styling products, dye your hair, or pick a haircut that hides a widening part, for instance. Use extensions or wigs, or shave your head. Consult a hairstylist for inspiration. Both permanent and temporary hair loss can be treated using these methods. That's all, folks. I hope you find this informative and hope you can share this to your family or friends that suffers hair loss. Thank you for watching. Please don't forget to like and subscribe.